Hello, my name is Ali Raza. My student ID S337780. I will talk about communication in safe care. Good communication is very important in healthcare. It helps doctor, nurses, and other staff work together to give safe care to patient. I will also talk about assertive communication. Assertive communication means speaking clearly, politely, with respect. It also means listening to other people and respect their ideas. This presentation to link to LO2, LO3 and LO5. It's explain why good communication is important for patient safety and teamwork. So now I will explain why communication is important in healthcare. What assertive communication is. As you can see on these slides, assertive communication is clearly direct and respectfully. It also useful verbal and non-verbal communication skills, and it is different from passive and aggressive communication. No, let me explain these points. Assertive communication means speaking clearly and politely. We share our thoughts, our feelings with confidence, but we also respect other people's opinion. It's including both verbal and non-verbal communication. Verbal communication mean the word we speak. Non-verbal communication mean our body language, eyes contacts, facial expression, and tone of voice. Assertive communication is different from passive and aggressive communication. A passive person may stay quiet while an aggressive person may speak in rude behavior. So an assertive person stay calm, speak clearly, and respected others. Strength of assertive communication. So now I will talk about strength and assertive communication. As you can see on slides, assertive communication build trust and rapport, reduce misunderstanding, encourage patient participation, and improve decision making. First, it's build trust and rapport. When healthcare staff speak honestly and respectfully, patients feel comfortable and trust them more. Second one, it reduces misunderstanding. Clear communication help everyone understand the correct information so there are fewer mistakes. Another strength is that it's encourage patient participation. Patients feel confident to ask questions, share their concern, and take part in decision about their care. Finally, assertive communication improves decision making when everyone shares information clearly and listen to each together. Critical analysis limitations. I'm going to talk about limitation and critical analysis. The first limitation is the people can sometimes take in the wrong way when we question on ideas or give feedbacks. Other may think we are going them personally. And second one, limitation is the circuital analyzing need confidence and practice practice. Not everyone feel comfortable sharing their opinion or challenging ideas, especially in a group decision. The third limitation is culture difference. In some countries or culture, asking question and different opinion as normal, but in other it may be seen as disrespectful. So while critical analysis is a useful skill, it can be different because of misunderstanding, lack of confidence, its cultural difference. Next, application in health and social care L02. The first point of discussing treatment option. Good communication help healthcare worker explain treatment choice to patients so they can understand and make the right decision. First one, so it's a second one, sorry. The second point is safeguarding concern. Communication is important for identifying, risking, and helping to keep people safe. And third one point is managing conflict. Good communication can help solve disagreements and reduce misunderstanding between staff and patient and families. The last point is adapting communication to service user. Healthcare worker should communicate in a way that suits the person age, language, culture and individual needs. Overall, effective communication is very important in health and social care because it's very important to provide safe and high quality support. Next one, person centered care LO3. The first point is active listening. This means carefully listening to what the person saying, understanding their need to concern. The second one point is empathy and respect. Their workers should treat people with kindness, respect, and understanding. And third one point is shared decision making. Patients should be involved in decision about their care instead of decision being made only for them. The last point is individual care planning. Every person is different, so care plans should be based on the specific need to performance. In conclusion, person centered care focus on individual and help provide better support and better outcomes. Collaboration and shared goal L05. The first point is support teamwork. This mean different healthcare professional work together to provide the best care patient. The second one point is improve information sharing. Good communication helps staff share important information clearly and accurately. Sorry. The third point is enhance patient outcome. When healthcare team work together, patient often receives better care and better result. The last point is reduce work conflict. Teamwork and clearly communication help misunderstanding and create a positive working environment. In conclusion, collaboration and shared goal help healthcare teamwork effective and provide high quality care patient. Next one, recommendation of improvement. The first one recommendation is communication skill training. Staff should regularly improve their communication skills so that can interact better with patient and colleagues. Second one, recommendation is reflective practice. This means learning from our own experience and thinking about what we did well and what we can improve is a third one. Recommendation is feedback and supervision. Getting feedback from manager and team members help us grow, improve and performance. The final recommendation is culture. competence development. It's very important to understand and respect people from different background, culture, and beliefs. Overall, this recommendation can help improve communication, teamwork, and the quality of care provided of service. Conclusion reference. I will now talk about the last part of my presentation, the conclusion and reference. As shown on this slide, so assertive communication is the best of most effective method in health and social care. It means speaking openly but always with respect other people. However, the people important point is that we can't always communicate in the exact same way. We must know how to adapt our communication style according to each person needs and specific situation. Every patient or client is a different. So finally, I have used the Harvard reference style to support my research, which you can see on my last slides. Thank you so much, sir.